Hey everyone, welcome back to our channel. My name is Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care, where you can find us at letsbamboo.com. So in today's video, we're going to be discussing a topic that we already planned on talking about, but was also brought up by one of our Treehouse members. Now, if you have no idea what the Treehouse is, it is this all-in-one dementia care resource library that has everything from videos, podcasts, blogs, activities, handouts, resources, webinars, and even a product catalog of products that are relevant to the dementia care journey. So we have two tiers available, with one of them being free. So if you think that this would be of benefit to you for your dementia care journey, then I strongly encourage you to join us at letsbamboo.com/treehouse. Okay? So the member wanted to know how to deal with her partner talking about things that haven't happened and getting very angry and upset with her when she tells him these things have not happened. She's tried changing the subject with positive subjects, but he gets back to the same delusion. Now, I have no context as to what these things are that her partner likes to talk about, and context does matter, but here's what I will say. The big question that you want to ask yourself is, does it really matter? Whatever your partner is saying, does it really matter? If it doesn't matter, let them believe whatever they want to believe and talk about whatever they want to talk about. So, I once had a gentleman with dementia tell me that back in the day he used to gamble with Trump. Now, whether or not this is true, I have no idea, but it didn't matter. So I just asked him about his experience gambling with Trump, and we had a really good conversation and a good time. So if your partner is confabulating, which basically means fabricating or misinterpreting memories, or holds a delusion, which is a false belief that they feel strongly about, and it's not really hurting anybody, it doesn't matter, it's not a big deal, then just go along with it. Ask them questions, learn more about their perceived experience, indulge in the conversation, and you may just learn something, whether it's true or not, okay? Now, in some cases, it may actually matter. For example, if whatever false memory or belief your person holds is causing them to become upset and hold anger and resentment towards innocent people, and it's causing issues in the household or with the people on the other side of the delusion, then it may actually matter. And so in these cases, what do we do? Well, let's first start with what we do not want to do, okay? So we never ever want to deny someone's reality. It doesn't matter if we know what they're saying is not true. It's true for them, and that's what matters. Have you ever had someone call you a liar when you were telling the truth? Or have someone challenge your recount of something when you know for a fact that's what happened and they're like, that's not what happened. That's not what I said. It's frustrating, right? And usually, what ends up happening is that you go back and forth with that person. You tell them the facts of what happened. They tell you what they believe to be true. And eventually, you all just have to say, you know what? We just have to agree to disagree because both of you feel that you are right. Well, this is very similar to what happens when you tell someone with dementia that what they're saying is not true, except there's usually not going to be that agree to disagree compromise. What ends up happening is that the person with dementia will dig their heels in deeper and become upset because essentially you're telling them that they're lying and you don't believe them, okay? And so that can turn really ugly, especially depending on what it is that they're trying to tell you, that you are then saying, no, that didn't happen, or no, that's not true. Okay? So, one thing that we have to understand is that with dementia, logic and reasoning is going to be impaired, and perspective taking is often impaired as well. So, to ask someone with dementia to take on your perspective and use logic and reasoning to see why what they're saying that they feel strongly about couldn't possibly be true is a losing battle. 9 times out of 10, you are not going to win that battle, okay? So it really does no good to try to convince or correct them on something they strongly believe is true. So, what should you do instead? Well, you still want to ask questions. You still want to learn more about their perceived experience. You want to see if you can figure out where this story may be coming from. You want to figure out what they're actually trying to communicate. And if they have a perceived problem, you want to see if you can try to fix that problem for them. A lot of times, if a person is continuing on and on about the same thing, it's because they don't feel heard or whatever need is associated with whatever they're trying to communicate has not been met. So it's perfectly fine to redirect someone to something else, but first you have to acknowledge and validate what they're saying, okay? They have to feel heard. So let me give you an example of a false belief or memory that may be a problem, okay? So let's say that your partner has a friend named Jimmy, and your partner is upset with Jimmy because they falsely remember a time where Jimmy came over and stole their watch. And because of this false memory and belief, they do not want Jimmy over the house. Jimmy is not welcome, okay? Now, this is a problem for you because you already invited Jimmy and May, who's your best friend, over for dinner. And now he's like, no, Jimmy can't come. He's not welcome here. What could you do? Well, you don't want to say, what are you talking about? Jimmy never stole your watch. He's only even been over here one time. And the time he was here, he was sitting on the couch the entire time. You don't want to do that. Instead, you want to ask questions from a place of curiosity. So you could say, oh, really? I didn't know Jimmy stole your watch. When was this? Oh, wow, I didn't know that. I'm sorry. Well, I would hate to uninvite Jimmy and May since it's so last minute. What if we put your watches in a safe place and when they come over, I'll make sure that I keep a really good eye on Jimmy and make sure he's not touching anything he's not supposed to. Now, they may go for it or they may not. So if your partner were to be like, no, that doesn't work for me, Jimmy is not welcome here, I do not want him here. What you could do is then cancel with May and Jimmy and explain. But please do not throw your partner under the bus, especially if your friends are not very understanding of dementia, because you don't want to taint their relationship. And your partner's delusion or belief could change, okay? And so if it does change, you want to leave that relationship in a good state so that things can basically pick up where they left off, okay? But the whole idea is to avoid arguments by joining your partner in their reality. And you want to think how you would respond if what they were saying were actually true, because it is true for them. But the tricky part sometimes is that you don't want to feed into the delusion, especially if it is harmful. So, if it will only increase their anger or resentment towards people. So, with the example I just gave, you wouldn't want to say, oh, that darn Jimmy, I can't believe he would do that to you. Why would he steal your watch? Oh my, like you don't want to feed into it like that, okay? You just want to acknowledge and validate the underlying feelings behind what they are trying to tell you, okay? But that is all for today's video. I hope that you found it helpful. If you did, please be sure to like and subscribe, as well as share this video with others who you think could benefit. If you have any questions or specific scenarios you would like me to address, feel free to leave it down below in the comment section. You can also join us inside the treehouse at letsbamboo.com/treehouse for more content like this. Until next time, bye guys.